Good morning, everyone. My name is Kenny Wu, and I'm the program coordinator at Welcome CTSC. Thank you, everyone, for joining us today on our introduction to Parkinson's disease and brain health presentation. Today, we're joined by Natalie Hallmerson, who's a nurse practitioner, and Mesa Trabilsi, who's a research coordinator from the Department of Neurology at Welcome Medicine. This presentation will be done in English and Spanish. If you want to ask any questions or want to talk to the presenters, there's a chat function at the bottom of your screen. I will also unmute you soon, and you can type in a question or ask the presenters, and they will be able to answer your questions during the Q&A section of the presentation. At the end, we'll also have a short anonymous poll about today's presentation. Please fill it out if possible. Muy buenos días, mi nombre es Kenny Wu y yo soy el coordinador de programas en Welcome CTSC. Muchas gracias a todos ustedes por atender nuestra presentación del día de hoy. El día de hoy vamos a tener una presentación titulada Introducción al Parkinson's y la salud cerebral. Hoy nos acompaña Natalie Hallmerson, quien es una enfermera practicante, y Melissa Trapelsi, quien es una coordinadora de ensayos del Departamento de Neurología en Welcome Medicine. La presentación va a ser en inglés y español. Si tienen preguntas, en la parte de abajo hay una sección donde nos pueden enviar un chat o un mensaje. Al final, vamos a tener una encuesta anónima sobre la presentación. Por favor, llénenla si pueden. Esta presentación va a ser grabada. Si quieren verla de nuevo, ustedes pueden acceder a nuestra página de YouTube.
So good morning, everybody, and happy March. It's nice that we have a sunny day in New York City, and spring actually feels like it's on its way. This is our fourth presentation with the CTSC, and our previous presentations can be found on YouTube. Our session will be recorded, so please listen to the following presentation, and all questions will be addressed at the end. You can share your question by speaker or by chat feature.
Bienvenidos. Esta es nuestra cuarta presentación con CTSC. Nuestras presentaciones anteriores se pueden encontrar en YouTube. Esta sesión va a ser grabada. Escucha la siguiente presentación y todas las preguntas serán respondidas al final de la presentación. Pueden compartir sus preguntas por altavoz o por función de chat.
So I thank you, Kenny, for the wonderful introduction. Once again, my name is Natalie Hallmerson. I'm a nurse practitioner at Weill Cornell Medicine outpatient.
Oh, Natalie, I think you're muted.
Thank you. Yes. Can you hear me now?
Yes, yes.
Okay. So Kenny, thank you for the wonderful introduction. Once again, my name is Natalie Hallmerson. I'm a nurse practitioner at the outpatient movement disorders and Parkinson's disease clinic with Weill Cornell Medicine. And my educational background is I have a bachelor's degree in nursing from the University of Scranton, a master's degree from New York University, NYU, and I'm currently enrolled at NYU working on my PhD. And happy to have my fellow colleague with me here, Mesa. Please introduce yourself.
Good morning, everyone. My name is Mesa Trabilsi, and I am a research coordinator who works with Natalie on these wonderful community outreach events. So a little bit about my educational background. I graduated from Hunter College with a BA, as well as earned a master's in education from NYU. I was actually a teacher for a couple of years. I taught middle school math before deciding to go back to school to become pre-med at Fordham University. And then I have been recently accepted into medical school, planning to start in 2021.
Conoce a tus presentadoras. Tenemos a Natalie Hallmerson, quien es una enfermera practicante y Su educación fue Universidad de Scranton y la Universidad de Nueva York. También tenemos a Mesa Travilsi, quien es una coordinadora de investigación y fue educada en Hunter College, New York University y Fordham University.
Alrighty, so let's begin. Let's start by talking about the outline of today's presentation. We're going to start with what are movement disorders. We're going to go into Parkinson's disease, and then its current treatments and management, and then we're going to end with a section on how you can keep your brain healthy. Next slide, please.
Los objetivos del día de hoy, vamos a hablar sobre qué son los trastornos de movimiento, qué es la enfermedad de Parkinson, cuáles son los tratamientos actuales y cómo puedo mantener sano mi cerebro.
So what are movement disorders? Movement disorders refer to conditions of the nervous system that cause increased movements or in other cases, slower or delayed movements. There are many types of movement disorders that exist. And in this particular presentation, we'll be discussing Parkinson's disease. Movement disorders occur from a problem in signaling in the brain and how the sensory system sends signals to the rest of the body to move a certain way. Next slide, please.
¿Y qué son los trastornos del movimiento? El término trastorno de movimiento se refiere a afecciones del sistema nervioso que provocan un aumento a los movimientos o, en otros casos, movimientos más lentos o retrasados. Existen muchos trastornos de movimiento y ocurren por un problema en la señalización en el cerebro y cómo el sistema sensorial envía señales al resto del cuerpo para que se mueva de cierta manera.
Okay, so what is Parkinson's disease? We can move on to the next slide here. Parkinson's disease is the second most common disease next to Alzheimer's disease in it's a neurodegenerative disease. It affects 1 to 2% of the US population. It is more common in men than in women. And the age of onset is 50 to 60 years old. Some most common clinical features are a tremor, which is an involuntary movement or a shaking, some stiffness, some slowness, and imbalance as well. Next slide, please.
¿Qué es la enfermedad de Parkinson? Es la segunda enfermedad neurodegenerativa más común después de la enfermedad de Alzheimer. Afecta al 1 o 2% de la población en los Estados Unidos. Es más común en los hombres que en las mujeres. Y la edad de inicio es de 50 a los 60 años. Características clínicas como temblor y se manifiesta con temblor al sentarse, rigidez, se manifiesta con dificultad para mover las extremidades, lentitud, problemas al usar las manos para escribir y abotonarse, y desequilibrio, pérdida del equilibrio, tropiezos, resbalones y caídas.
So a little bit more about Parkinson's disease. It's a brain and nervous system disorder that affects the brain's ability to control movement in addition to other functions. So it manifests usually in bradykinesia, which is slowed movement, tremor, an increase in rigidity, and postal instability. All right, next slide, please.
¿Y qué más es la enfermedad de Parkinson? Son trastornos del cerebro y del sistema nervioso que afectan la capacidad del cerebro para controlar el movimiento, además de otras funciones. Por ejemplo, la dyskinesia, temblor asimétrico, rigidez, inestabilidad postural y
All right, who is affected by Parkinson's disease? So as we stated before, there is a higher percentage of men over women who are diagnosed. And current research have shown that white communities have a higher prevalence in comparison to Black communities. Next slide, please.
¿Y quién está afectado por la enfermedad de Parkinson? Aunque las estadísticas han variado, la comprensión de la enfermedad de la proporción del género sugiere que se diagnostica en un mayor porcentaje de hombres que de mujeres. La prevalencia de la enfermedad de Parkinson parece variar geográficamente y la investigación actual sobre raza y etnia y la enfermedad de Parkinson muestra que las poblaciones de raza blanca tienen una mayor prevalencia en comparación con las poblaciones de raza negra. Sin embargo, estos datos están limitados por el sesgo de verificación.
Some factors associated with the risk of Parkinson's disease, the most notable are aging, family history of Parkinson's, chronic inflammation, head trauma, and stress. Next slide, please.
Algunos factores asociados con el riesgo de la enfermedad de Parkinson incluyen el envejecimiento, género masculino, agricultura, encefalitis, metales pesados, entre otros.
All right, some genetics in Parkinson's disease. It does play a part, although 90% of Parkinson's disease is sporadic. Among Ashkenazi Jews with Parkinson's disease, there's a higher likelihood of genetic predisposition compared to non-Jews with Parkinson's disease. The most common genetic risk factors for Parkinson's disease among those of the Ashkenazi Jewish descent are LRRK2 and GBA. Next slide, please.
Genética en la enfermedad de Parkinson. Aproximadamente el 90% de la enfermedad de Parkinson es esporádica. El resto se ha relacionado con causas genéticas. Entre los judíos ashkenazis con la enfermedad de Parkinson existe una mayor probabilidad de predisposición genética en comparación con los judíos, con los no judíos con enfermedad de Parkinson. Los dos factores de riesgo genético más comunes de la enfermedad de Parkinson entre los descendientes de los judíos ashkenazis son LRRK2 y GBA.
Okay, so what happens to someone with Parkinson's? This diagram shows you the symptoms as they manifest. I think the most notable ones are the stoop posture, the hand tremor, the masked face, and the shuffling that is possible. All right, next slide.
¿Qué le sucede a alguien con Parkinson? El diagrama que está en la parte derecha nos presenta cuáles son algunos de los síntomas que puede tener una persona con Parkinson, como por ejemplo temblores de las manos, la postura hacia adelante.
So there are three key terms to keep in mind and to understand throughout this presentation and in the literature of Parkinson's disease itself. This kind of becomes a terminology and vocabulary all its own. So these key terms are premotor, motor, and non-motor.
Tres términos claves sobre la enfermedad de Parkinson, premotor, motor y no motor, y ahora vamos a hablar sobre los síntomas de la enfermedad de Parkinson también.
Premotor symptoms refer to features that may precede the onset of Parkinson's disease physical manifestation by many years. For example, studies have shown that REM, sleep behavior disorder, RBD, or constipation, decreased smell acuity, hyposmia, and mood changes like depression and anxiety all serve as premotor symptoms, right? Meaning that a person may exhibit these far before having any physical motor sign of Parkinson's disease.
¿Qué son los síntomas premotores? Estas características pueden preceder muchos años a la aparición de las manifestaciones físicas de la enfermedad de Parkinson. Ejemplos de síntomas premotores incluyen trastorno de comportamiento REM, estreñimiento, disminución de la agudeza del olfato y la depresión y la ansiedad.
Motor symptoms, which are the physical symptoms, can appear with a great variety. For example, slowness, stiffness, and tremor, which tend to be the three classic symptoms. And as we've seen on a previous slide with the image of a person, and also here, there can be changes with gait, shuffling, poor balance, freezing of gait where the feet get stuck. A person's posture can change. There can be a reduction in the voice, slurred speech, small handwriting, right, where a person may say that they used to have always such nice big handwriting and suddenly it has gotten smaller. Difficulty turning in bed. So these are all examples of motor symptoms. And to keep in mind that a person might not get all of these, they can be present, as I mentioned, with variation person to person.
Entonces, ¿cuáles otros síntomas motores se presentan en la enfermedad de Parkinson? Como vimos antes en la imagen, hay ejemplos como de lentitud, rigidez, temblor, equilibrio, marcha arrastrando los pies, también congelación, balanceo de brazo reducido, expresión facial reducida. Muchas personas también se quejan de letra pequeña, escoliosis y postura muscular anormal.
So we talked about the premotor and the motor symptoms. For non-motor symptoms, these include things like changes with thinking and memory. A person might have some difficulty with planning, multitasking, or remembering complex details. There may be some psychiatric symptoms, such as hallucinations, where a person might visualize things that are not actually there. Again, in combination with mood changes, like feeling sad or depressed or feeling anxious or jittery. And there may be sleep issues, so difficulty sleeping, difficulty staying asleep. Once again, acting out dreams or acting out dreams so much that they might actually fall out of bed while doing so. And then with poor sleep issues, often comes excessive daytime sleepiness.
Y ejemplos de síntomas no motores incluyen problemas de pensamiento y memoria, dificultad para planificar y realizar múltiples tareas y recordar. Aparte de eso, también hay síntomas psiquiátricos, como por ejemplo alucinaciones, sentirse deprimido, sentirse ansioso o nervioso. Y también las personas con la enfermedad de Parkinson pueden tener problemas de sueño, que incluyen dificultad para dormir, actuando sueños y hasta cayéndose de la cama, y somnolencia diurna excesiva, básicamente sueño en el día.
To continue our explanation of non-motor symptoms, there also may be urinary frequency or urgency, orthostatic hypotension, which is the changing of blood pressure, where blood pressure may suddenly become low, often occurring when a person changes position. So if, let's say, you're sitting for a while and stand up suddenly, and the blood pressure might drop. Again, this is kind of a common non-motor symptom in Parkinson's. The gastrointestinal problems, very much we see constipation, as well as an early fullness. So a person might suddenly find that they're just not as hungry. Their appetite might not be as strong as it was once before. There can be sweating, and sweating outside of, just hot or warm temperatures, and also sexual dysfunction can be a non-motor symptom.
Otros ejemplos de síntomas no motores incluyen la frecuencia, urgencia urinaria, hipotensión ortostática, básicamente es el cambio de la presión arterial, que da presión arterial baja, problemas gastrointestinales como el estreñimiento y la plenitud temprana, que es cuando las personas se llenan mucho más rápido, transpiración y disfunción sexual.
So how does one get a diagnosis of Parkinson's disease? Basically, this is diagnosed by a neurologist or doctor who diagnoses disorders of a brain. Basically, there's so many different fields of neurology right now. And while a general neurologist can make this assessment and can get, let's say, a hunch that this is the diagnosis, quite commonly, and this is even suggested, that a general neurologist would refer a patient with possible Parkinson's disease to a movement disorder specialist. And a movement disorder specialist is basically a doctor who really is specialized in this disorder. It is a clinical diagnosis based on a neurological examination. And sometimes, if things are not so crystal clear, additional tests may be obtained to rule out other diseases, right? Because there are certain conditions that can mimic Parkinson's.
Diagnóstico de la enfermedad de Parkinson. ¿Quién puede diagnosticar la enfermedad de Parkinson? Los neurólogos o médicos que diagnostican el trastorno del cerebro, o un neurólogo también puede derivar a un paciente con la enfermedad de Parkinson a un especialista en trastorno del movimiento. ¿Cómo se diagnostica la enfermedad de Parkinson? La enfermedad de Parkinson es un diagnóstico clínico y se basa en un examen neurológico. A veces se obtienen pruebas adicionales para descartar las otras enfermedades.
So there's a lot to unpack in this slide here. So at diagnosis, of course, one actually has to hear the diagnosis before to start really treating and dealing with it. A confirmation of the diagnosis must be attained. And as far as the question as to who to tell, this is also, it's a big question. Studies show that about 90% of people actually do disclose fairly early to family members, at least core family that they feel very close to. Many people that are working and have Parkinson's do decide to delay by at least up to 1 year to tell people at work. So it's about 25% of the studied population. This was back in 2006. So kind of curious as to maybe what more current studies would show regarding to sharing this information with one's boss and one's coworkers. And then, of course, once the diagnosis is discovered and confirmed, it's all about finding the right team, right? So having a neurologist on board, having a primary care doctor on board. I'm amazed at how many people I meet who don't have a primary care doctor, finding a therapist if it's needed, getting to know a personal trainer that can help. Of course, support groups, which I'm a big promoter of. And then, of course, finding the right team of close family and friends that can support a person. There's, of course, the question of medication. Should you start and when to start? And that, of course, is the discussion to have with your provider. And then how much to read. The internet has such a wide, vast amount of information, but how much of it is correct? How much is speculation? And so that's a really important question. The research, should you get involved and how soon? And we welcome everybody to take a look at the website, clinicaltrials.gov and Fox Trial Finder. Of course, it's suggested to do annual checkups, like doing very important things like getting one's vision checked, visiting a dermatologist, of course, also very important to check for things like melanoma, for example, which is a slight higher prevalence for those with Parkinson's.
¿Y qué tenemos que hacer en el momento del diagnóstico? Lo primero que hay que hacer, claro, es que escuchar el diagnóstico. Y a quién decírselo, 90% de las personas le informan temprano a un familiar. En el trabajo, 25% de las personas esperan por lo menos un año antes de avisarles a otras personas en el trabajo. Este estudio fue en el 2006 y hay que ver cómo ha cambiado más recientemente. Aparte de eso, también hay que encontrar el equipo adecuado. Esto incluye neurólogos, atención primaria, terapeutas, entrenadores personales, grupos de ensayo, familias y amigos, ¿no? Medicación. ¿Cuándo deberíamos empezar medicación o medicamento para la enfermedad de Parkinson? Aparte de eso, ¿cuánto leer? Hay mucha información online y hay que saber cuánto leer. Ah, y si uno quiere participar en investigaciones, hay dos páginas online como clinicaltrials.gov y Fox Trial Finder. Y aparte de eso, también sugerimos hacerse un examen de la vista anual, por catarata, y también visitar a un dermatólogo una vez al año también.
And so moving on to what is current treatment and management of Parkinson's disease.
Y ahora vamos a hablar sobre cuál es el tratamiento y manejo actual de la enfermedad de Parkinson.
So treating Parkinson's has really changed over the vast decades. And I really love this slide. I've been editing it and it's only getting bigger. So in the middle is the patient, and around are all the possible core team members of care that would provide help to a person with Parkinson's. And this is important, right? Because all of these care providers have something different to offer. And of course, communication is really key between all these care providers. So for example, a person with Parkinson's might be seeing a neurologist and a sleep medicine specialist. They might get a memory evaluation. They might be seeing a psychiatrist, a physical therapist, an occupational therapist, or a social worker. So all key roles, and all have become more and more specialized in treating really the whole person.
¿Y cómo ha cambiado el tratamiento de la enfermedad de Parkinson? Como dijimos antes, hay que encontrar un equipo adecuado para poder tratar la enfermedad de Parkinson. En el ejemplo, en la imagen, en el centro están el paciente y alrededor está el grupo o el equipo de cuidado. Esto incluye, como dijimos antes, un neurólogo, terapeutas, entrenadores personales, atención primaria, grupos de apoyo, familias y amigos.
So to start, right, when somebody gets a diagnosis of Parkinson's, very often, and this is fairly universal because it's in the literature of doctors and nurse practitioners who treat people with Parkinson's, that a general assessment of one's level of exercise and physical activity is attained. And if there isn't much exercise or physical activity in one's life, it will be recommended. So with the help of physical or occupational therapy, if it's needed, utilizing speech or swallowing therapy if it's needed, and then getting the treatment that's related to it. Doing things like yoga, Tai Chi, cycling, boxing, dancing. Over the years, there's been just a flux of these wonderful programs that have come up in the local community, including Dance for Parkinson's, Rock Steady Boxing, the big program, the LSVT speech therapy program. There are so many avenues for exercise that are available. And it's really important to have that conversation, knowing what's available and then pursuing these things.
Ejemplos de tratamiento de la enfermedad de Parkinson incluyen el ejercicio y la actividad física, que también mejora los síntomas de la enfermedad de Parkinson no motores. Aún no se recomienda un plan de ejercicio específico, aunque se están estudiando varios que incluyen como yoga, tai chi, ciclismo, boxeo y baile. Y a menudo la fisioterapia, la terapia ocupacional o terapia del habla son útiles para diseñar tratamientos. Aparte de eso, también hay terapias Big y terapias Loud. Y también hay terapias del lenguaje LSVT.
Parkinson's disease treatment. So, while we don't necessarily think about these as two, completely separate pathways, there is the pharmacological direction, which is usually where we begin. Looking over to the left, right, we have levodopa and all of its different variations, right, where there's a carbidopa levodopa IR, which is the immediate release, ER, which is the extended release. There's Rytari, which is the combination of both. There's now an intestinal gel. There's also inhaled levodopa. And so the next column over under others, there's all these different types of medications. And some of them are taken alone as monotherapy, while others are taken together. There can be a combination, right? So a person may be on just 1, 2, 3, or even more variation of these medications, again, depending on what the symptoms are and how a person is responding to the medications. Oftentimes, finding the correct dose can take a while, and a person may be on medication for many, many years. So long as they're not having complications, medication management can really go a long way. If there are some changes and possibly more symptoms, and possibly where side effects of medications become stronger than the actual benefit of medication, surgery may be suggested, right? So that's, again, the other avenue, though not necessarily a path that's taken alone. And the surgical options right now include deep brain stimulation and focused ultrasound. And quite commonly, you'll see DBS for deep brain stimulation and FUS for focused ultrasound.
Aparte de eso, también tenemos tratamientos farmacológicos que incluyen la levodopa, carbidopa levodopa IR, que es básicamente es de liberación inmediata, y carbidopa levodopa IR, que es medicamento de liberación prolongada. También tenés Ritari, que es los dos juntos al mismo tiempo, gel intestinales y la levodopa inhalada. Otras incluyen antagonistas de dopamina, ejemplos de esto, la amantadina y anticolinérgicos. O también hay cirugías o tratamientos quirúrgicos, como la estimulación cerebral profunda, TBS por sus siglas en inglés, y ultrasonidos enfocados, FUS por sus siglas en inglés. Y la enfermedad de Parkinson es heterogénea. No hay dos personas con enfermedad de Parkinson iguales. El tratamiento debe ser individualizado.
So just to give you a little bit more information on deep brain stimulation, so it is a surgery. Electrodes are inserted into the basal ganglia of the brain, and a second procedure is performed to implant a battery, which does resemble a pacemaker. So if you've ever seen what a pacemaker looks like, which probably a bit more commonly found in the general population, the battery sits in the chest wall, and you can see that on this image here. The battery provides an electrical impulse to the part of the brain that's actually involved in motor function. And a person who undergoes this surgery is given a controller, and they're actually able to turn their own device on and off. And deep brain stimulation treats things like tremor, bradykinesia, which is the slowness, rigidity, motor fluctuations, right? I had mentioned before that if a person starts to have side effects, and kind of a side effect is having a moment where maybe the medication is working and then suddenly that medication might just stop working. And if this happens repeatedly throughout the day, this is not really good. It becomes much harder to live with Parkinson's. And therefore, deep brain stimulation can actually help with that, with the motor fluctuations. And also for dyskinesia, which is the involuntary movement, another side effect of medications.
Estimulación cerebral profunda. Los electrodos se insertan en la parte de los ganglios basales del cerebro. Se realiza un segundo procedimiento para implantar una batería como un marcapasos en la pared torácica. En la imagen la podemos ver, en la imagen de la derecha lo podemos ver. La batería proporciona un impulso eléctrico a la parte del cerebro involucrada en la función motora, y a quienes se someten a una cirugía DBS se les proporciona un controlador para encender o apagar el dispositivo. ¿Y qué trata el DBS o la estimulación cerebral profunda? Temblores, bradicinesia, rigidez, fluctuaciones motoras y la disinesia.
The other treatment besides deep brain stimulation, which is an alternative, right? A person actually wouldn't be getting both. An alternative is the focused ultrasound. And this is a non-invasive therapeutic technique that uses these non-ionizing electronic waves to heat or ablate, which actually means to remove tissue. Basically, these really strong ultrasonic waves create a lesion. And the ultrasonic waves, basically, it focuses the beam of ultrasonic energy precisely on targets deep in the brain, and it's guided by MRI imaging at the time. So here on the right, you can see, very, very deeply in the brain is a target spot. The FDA did approve this for essential tremor as well as Parkinson's tremor. And we just completed enrollment for treatment of levodopa-induced complications. And so now we're following people to see how they are doing. But the focused ultrasound has been rather successful so far.
Otro tratamiento alternativo a la DBS es el ultrasonido enfocado y guiado por resonancia magnética. Esta es una técnica terapéutica no invasiva que realiza ondas ultrasónicas no ionizantes para calentar o extirpar, remover tejido. Enfoca rayos de energía ultrasónica con precisión en objetivos en la profundidad del cerebro guiados por imágenes de resonancia magnética. Ha sido aprobada por la FDA por temblor esencial y temblor de Parkinson. Y acabamos de completar la inscripción para tratamientos de complicaciones inducidas por Levodopa.
So the Parkinson's disease prognosis. A prognosis varies from person to person. As I had mentioned earlier, symptoms will vary person to person. A key point to keep in mind, if you really take away anything from this talk today, is if you do have a diagnosis, follow up with a neurologist. If you're prescribed medications, take them regularly. Try your best to reduce stress, because stress on the brain helps no one. Try to maintain a healthy diet, and of course, exercise on a regular basis. There's the expression, right? Can someone die from Parkinson's, right? It's a common question. So Parkinson's disease does not actually kill you. It's not a terminal illness. However, there are avoidable complications that can cause death. So things like pneumonia, if a person isn't swallowing well and they don't get that evaluated properly, there is a concern that they could become vulnerable to choking. Of course, if a person's not moving as well, if their balance is affected, they are at higher risk for injury if they fall. So these are all those what we call avoidable complications that are really important to keep in mind. Addressing swallowing and mobility issues early on can actually help to avoid problems in the later stage of the disease course.
¿Cuál es el pronóstico de la enfermedad de Parkinson? El pronóstico varía de persona a persona. Entonces, hay puntos clave. El día de hoy sugerimos que haga un seguimiento con un neurólogo, tome medicamentos con regularidad, reduzca el estrés, mantenga una dieta saludable y haga ejercicio con regularidad. Una de las cosas que debemos decir es que la enfermedad de Parkinson no mata. Sin embargo, existen complicaciones evitables que pueden causar la muerte. Ejemplos de estas son la neumonía, asfixiarse al tragar comida y lesiones por caídas. Entonces, sugerimos ayudarle los problemas de deglución o problemas al tragar la comida y agua y problemas de movilidad desde el principio para evitar problemas durante la etapa posterior del curso de la enfermedad.
Okay, so how can you keep your brain healthy? Let's dive into that a little bit more. We could go ahead to the next slide.
¿Y cómo puedo mantener sano mi cerebro?
So we're going to start off by talking about nutrition. Nutrition involves more vegetables and fats like olive oil, smaller amounts of lean protein, more fruits, nuts, grains, and beans, green vegetables, and drinking lots of water. Next slide, please.
Vamos a comenzar con la nutrición, que incluye más verduras y grasas como el aceite de oliva, cantidades más pequeñas de proteína magra o proteína sin grasa, más frutas, nueces, granos y frijoles, vegetales verdes y beber mucha agua.
Next up is exercise. Researchers have found that exercise training not only improves muscle strength and function, but also has these benefits. It reduces motor symptoms. So it's actually one of the treatments of Parkinson's disease, as we discussed earlier. It can enhance the efficacy of levodopa therapy, which is one of the medical treatments for Parkinson's disease. It can improve endurance. It can improve gait disturbance, so any type of walking issue. It can improve cognitive function and overall quality of life. Next slide, please.
En el ejercicio, los investigadores han descubierto que el entrenamiento físico no solo mejora su fuerza y su función muscular, sino que también tienen estos beneficios. Reducen los síntomas motores, mejoran la brasinesia, que es el movimiento, que son los movimientos lentos, y la inestabilidad postural, uno de los tratamientos de la enfermedad de Parkinson. También mejora la eficacia de la terapia con levodopa, mejora la resistencia, mejora la alteración de la marcha, problemas al caminar, y mejora la función cognitiva y generalmente mejora la calidad de vida en general.
Next up is sleep. It's very important to get your sleep to be evaluated with a sleep study. So things like sleep apnea, REM sleep behavior, restless legs, any other type of sleep issue. It's important to have good sleep hygiene, some lifestyle changes, medication or devices to support better sleep. And a better rested brain thinks and performs better, and mood usually improves as well. Next slide, please.
Dormir, esta evaluación del sueño con un estudio del sueño que incluye apnea del sueño, comportamiento de sueño REM y las piernas inquietas, una buena higiene del sueño, cambios en el estilo de vida y medicamentos o dispositivos para ayudar a dormir mejor. Y generalmente, ¿no? Un cerebro mejor descansado piensa y se desempeña mejor. Y el estado de ánimo generalmente también mejora.
And last but not least, it's very important to socialize. So studies have shown that people need human contact, especially, during the time of the COVID pandemic. It's very, useful to use many of the virtual options to stay connected. It enhances brain function, and along with the word puzzles, learning new tasks, challenges the brain and can straighten a person's cognition. Next slide, please.
Y socializar. Los estudios han demostrado que las personas necesitan contacto humano. La pandemia ha puesto a prueba el sentimiento de satisfacción y conexión a muchas personas. Utilicen las muchas opciones virtuales para mantenerse conectado. Esto incluyen el teléfono, Skype o hasta Zoom. La socialización mejora la función cerebral y junto con los rompecabezas de palabras, aprender nuevas tareas, socializar, desafía el cerebro y puede fortalecer la cognición de una persona.
Okay, so in conclusion, the Parkinson journey is very complex. It is important to have support from family, friends, and medical professionals, but it's definitely possible to live a rich, full life with Parkinson's disease. Next slide, please.
Y en conclusión, el viaje del Parkinson es complejo. Necesitamos apoyos de familiares, amigos, profesionales médicos y es posible vivir una vida plena y rica con la enfermedad de Parkinson.
All right, so if you guys have any questions or comments, feel free to type into the chat box. We just want to say a special thank you to our team, Dr. Nawobi, Dr. Sarva, and right below on the very bottom is our clinic address as well as our phone number.
Esta parte, si tienen alguna pregunta o comentario, estén atentos a nuestra próxima charla Civic. Un agradecimiento especial a la doctora Linda Nobobi y nuestro equipo. En la parte de abajo, la ubicación y el número de teléfono. So now I'm going to say that we should start I will start the poll. En esta parte vamos a comenzar el poll y llénanla si pueden. This poll will be anonymous and feel free to ask questions now. A couple of questions I do have, and I will say it in English and then in Spanish. Okay, so for today, is there a discussion today on having Parkinson's and using technology, computers or iPhone? Hay discusión en el día de hoy, cómo usar la tecnología como computadoras o iPhone. I can answer this question. We had a presentation about technology in the past. I think it was a couple of months ago, and that one is on our YouTube channel. Tuvimos una presentación sobre tecnología y esto se puede encontrar en nuestra página de YouTube. Agnes, if you could copy or just put the YouTube channel in the chat box, please. Thank you. And then question number 2. Oh yeah, so this one is a question about Levodopa. What are some examples of complications? ¿Cuáles son los ejemplos de complicaciones por Levodopa?
So I'm happy to jump on that question. So some complications of levodopa, again, these are considered side effects. Some people do have nausea. Nausea is, I would say, common. Then again, there are some people who have no nausea whatsoever. Besides nausea, there can be a little bit of a lowering of blood pressure. So in some cases, if a person already is sort of predisposed to having low blood pressure, that would be something to keep in mind, especially with higher doses of levodopa. Another example of a side effect would be dyskinesia. I had used the word dyskinesia in a previous slide, which is an involuntary movement, sort of like a swaying of the head, the arms, the legs. It could be a localized body part, or it could sort of be swaying all over. Again, not everybody develops dyskinesia. And if it does happen, it tends to happen with higher doses. But again, people are different. So probably the fourth other concerning side effect would be hallucinations, which again, rarely occurs with low doses. But down the line, if somebody is on it for a rather long time and doses do inch up higher and higher, it's just something to keep in mind.
complicaciones de levodopa incluye náusea, vómito, la discinesia, que es básicamente un trastorno que consiste en movimientos involuntarios, y también otras cosas como pérdida del apetito y confusión. And then next question is, what sleep medication is recommended? ¿Qué medicación para dormir es recomendada?
Happy to answer that one. So, believe it or not, melatonin is a great supplement to use for sleep. It's a neurochemical that's available over the counter. If a person really does have trouble getting into a good sleep rhythm, melatonin can help. Even small doses taken at bedtime. Adjusting one's sleep habits is really important as well. And honestly, something, as a nurse practitioner, this is what I advise many patients that I see in the clinic, really assess, what are you doing during the day that might be affecting your sleep? Are you napping a lot? Are you drinking caffeine real late? Do you have all the lights on in your bedroom with the TV on and all this sort of stimulation? So if you can make these lifestyle adjustments, get plenty of exercise during the day, try to go to sleep and wake up around the same time. If that still doesn't work, then pursuing basically like medication to help. Things like Ambien can work. Also, although it's really a medication that's geared for mood, something like trazodone can be helpful as well.
I do want to add quickly, kind of before you interpret, the other thing that's important to note is the power of snoring. If you're someone who snores, you need to get that checked out and make sure that you don't have sleep apnea. When you're snoring, you don't get enough oxygen to your brain and you're not getting restful sleep. So you end up feeling very tired all day and you just wake up not feeling good, like you slept well. So if you're someone who snores, see your doctor, get a sleep study, and they will likely prescribe something like a CPAP machine to help you breathe better and get more restful sleep.
Okay, para el sueño se recomienda la melatonin, que está disponible sin receta. Aparte de eso, es importante ajustar un hábito del sueño. Hay que evaluar lo que uno hace al diario para hacer ajustes en su estilo de vida, como por ejemplo, si ha tomado café muy tarde o si está haciendo mucho ejercicio o muy poco ejercicio. También buscando medicación para ayudar como Ambien. Y al final también se dio un ejemplo de asegurarse de no tener apnea de sueño debido a los ronquidos. Esto hay que hacerse un estudio de sueño para poder saber si tiene apnea de sueño. And the next question is, we have a whole bunch of questions actually, so I am going to try to go over a couple of these. So it says, if one is at the beginning of Parkinson's, can the condition be reversed so that one returns to normal? Si una persona está en el comienzo de Parkinson's, ¿se puede revertir la condición para regresar a lo normal?
So I have seen patients in the clinic do rather well, where maybe they come in and they do have some early symptoms. Again, if they make a lot of those appropriate lifestyle changes that we mentioned today, possibly start some medication, their symptoms can really decrease.
He visto pacientes en la clínica que se han comportado bastante bien al comienzo de la enfermedad de Parkinson. Una cosa importante es realizar los cambios del estilo de vida adecuados, posiblemente comenzar con algún medicamento. And then the next question is,
Hi, how do I ask a question? Do I leave a message or a
Oh,
text?
you can
or-
just ask it as well right now if you want.
Can I ask right now?
Yeah, feel free to unmute yourself as well. But if possible, use the raise your hand function. But yeah, you could ask the question right now.
Oh, thank you.
Mhm.
My mom has a question about her jaw. It feels like very stiff and rigid, and difficulty opening it, and her tongue, like difficulty using her tongue, and it kind of feels like her throat is squeezing shut, and her jaw is squeezing shut. I don't know if this is, I guess I don't know what this is from. Sometimes she feels like when she doesn't get good sleep, a good night's rest, that's where like this comes from, but I don't know.
Does your
And
mother,
is it possible that it's the medication? She doesn't know either.
does your mother have Parkinson's?
Yes, she does.
Okay, just wanted to clarify. So that's a difficult question to answer without examining the patient.
Yeah. So,
Potential etiology could be dystonia. Dystonia is abnormal posturing of muscle, which we sometimes see in.
and she has Parkinson's and dystonia.
Okay, so it could be a manifestation of that. But to answer your question fully, your mother would need to be examined and to get more history.
Okay.
And certainly this is something that, right, when we're worried about jaw, we're worried about swallowing, speech therapy, getting an evaluation and kind of seeing, what's happening to these symptoms with medication. I do have a number of patients in the clinic who have like kind of a jaw tightness or even like a jaw clenching that can occur throughout the day in between doses that does wax and wane. Again, dystonia presents itself very different with people. So sometimes it's even hard to figure out, is it a dystonia that's getting exacerbated from peaks and valleys of doses? I don't know if there was an echo or a question.
I think that was an echo. Yeah. So I'll translate it now. La pregunta fue que el paciente tiene la mandíbula que se siente muy rígida y tiene dificultad al abrir su garganta y siente que está apretando y cerrando. Y la respuesta fue que la pregunta es difícil de responder sin examinar al paciente. Puede ser posible que sea una manifestación de distonia y obtener una evaluación médica es esencial. And I will go to the next question. It asks, does DBS or deep brain stimulation replace levodopa? La pregunta fue que si DBS reemplaza el uso del levodopa.
So deep brain stimulation in certain cases, depending on exactly how the surgery is done, what areas are targeted, for some people can lower doses. Whether a person gets off medication completely, that does depend. Depends on severity, again, depends on the whole picture. But it can serve as a pretty significant reduction in levodopa.
La terapia DBS puede disminuir el uso de medicamentos, pero eso sí, depende de la persona. And the next question is, I have a lot of questions actually. What is good sleep hygiene? ¿Qué es el higiene bueno de sueño?
Something that many New Yorkers do not know because we are the city that never sleeps. So good sleep hygiene, right? As we say, hygiene, how we take care of oneself, basically means, as I had kind of alluded to before, keeping a sleep pattern, right? So purposely trying to go to bed at the same time and waking up around the same time, not allowing too much stimulation with the computer and the TV and all the blue lights that actually can start waking up the brain. I know many of us love Netflix, but if we start binging on television late at night, we actually might be affecting our good, deep REM sleep. So doing things like that, not getting up in the middle of the night and snacking on sugary snacks, even though it seems to be a big temptation for many of us. So again, eliminating all those things that can affect your good sleep at night.
Sorry, I was replying to a message. Algo de qué es lo que es buena imagen, buena higiene del sueño, es algo que muchos de los neoyorquinos no saben. Una buena higiene del sueño significa mantener un patrón de sueño, por ejemplo, acostarse a la misma hora, despertarse a la misma hora y no permitir demasiada estimulación con la computadora o televisión. Aparte de eso, también incluye no levantarse en el medio de la noche y comer bocadillos azucarados y eliminar estas cosas que pueden afectar su buen sueño por la noche. And the next question is, oh, can you share your screen again with the address and the phone number?
Sure.
Okay. It says TV ads are running for drugs to treat Parkinson's disease related dementia. You didn't mention this symptom. Is it common?
I can answer that while you find the information.
Thank you.
The Parkinson's disease dementia is one unfortunate symptom of Parkinson's disease that we often see as the disease progresses. It can be somewhere around 75% of people after about 15 to 20 years of having the disease can have mild cognitive impairments or dementia symptoms. And so this is something that we do see. And then in terms of treatment and the medications that are available for this, there are some medications that we have for it, and people have mentioned oftentimes that they see commercials for these medications that oftentimes are scary when people are having hallucinations. But again, dementia is not something that we see in everyone, but it is a symptom that can be seen as disease advances. It's not something that we see early on in the disease.
La pregunta fue que los anuncios de televisión mencionan la demencia en la enfermedad de Parkinson. La respuesta, puede sucederle a algunos pacientes con enfermedad de Parkinson. En términos de tratamiento o medicación, existen algunos medicamentos disponibles. Eso sí, este síntoma no es muy común al comienzo, pero puede que comience, pero puede que salga a la mitad o al final de Parkinson. And the next question, oh, that's a lot of messages. What do you consider high dosage of levodopa?
I can take this question also, and we may have to do another session where we answer more questions. The goal of this session was just an introduction to Parkinson's, and but obviously people have many questions, which we're very happy to answer. To answer the question, so levodopa, there is no specific dose where we say, okay, this is where we stop. Everyone is different based on the patient's functionality, their movements, and what deficits they have. That's how we titrate the medication. And so what tells us to stop is either we see that the individual is responding to the dose that we're giving them and they're tolerating it well, and we stop there and everyone's happy. Or if the body starts to have side effects, that's the other thing that stops us. So in general, we increase the dose to the point where we see improvement in functionality, but not having any side effects. So in general, people with early mild disease are on very low doses or none at all. And people with more advanced disease may be on much higher doses, but there is no specific number where we're looking at and targeting.
La pregunta fue, ¿qué consideras una dosis alta de levodopa? No hay dosis específica, ya que cada persona es diferente según la funcionalidad y el movimiento del paciente. O si hay efectos secundarios, la dosis es aumentada hasta el punto en que vemos una mejora en la funcionalidad y calidad de vida del paciente. And I think we'll take a couple more questions. Let me see what time. I think we could do 2 more questions or so. And the rest of the questions, I will email you. And I suppose we'll send out a blast email with all the answers. That's how we'll do it. Or I could also put it at the bottom of the YouTube channel where there's a description section. I guess we could put it there as well. So I'll copy the questions a little bit later, but let's go for the next question, which says,
Hello.
oh yeah, you can ask your question.
Oh, what do you think of acupuncture to treat Parkinson's?
So I'm happy to answer that one. I have heard of some benefits to acupuncture. Again, just from my verbal conversation with patients who've been doing it for a while. I did have a gentleman do a presentation about 2-3 years ago, sort of explaining the overall benefits. So while acupuncture, might not directly, target motor symptoms, if done correctly and appropriately, and sort of in a way where the person doing the acupuncture has kind of a good vibe with the person who is doing this, their stress level can be relieved, with less stress and anxiety, relaxation. A person's movement might actually improve, tremor might go down if there's any cramping or pain or discomfort in the body. Acupuncture can alleviate that. So again, while I'm not aware of any official targeted program directly for Parkinson's symptoms, as an alternative medicine approach that can help with other things, it may be beneficial for a person.
Thank you.
You're welcome.
¿Qué piensas sobre la acupuntura para tratar el Parkinson? Si la acupuntura, aunque la acupuntura no puede afectar directamente los síntomas motores, si se realiza de manera correcta y adecuada, se puede aliviar niveles de estrés, lo que puede mejorar la relajación y el movimiento de la persona. And then, can Parkinson's disease be prevented?
I can take this question. We do know, I remember one of the slides showed some of the risk factors for Parkinson's disease. So we do know that certain things can increase the risk. Is it preventable? Currently, there is no, specific medication that, we're giving people that would prevent Parkinson's. However, we do know that the risk of Parkinson's disease reduces better brain health. And that is why we emphasize that as part of this talk. So reducing the risk of any damage to the brain, things like, high blood pressure, high cholesterol, smoking cigarettes, diabetes, kidney disease. So anything that, that's going on in the body can affect your brain health. And with more severe disease of the brain, your risk of Parkinson's disease increases. So I think that the main answer is try and protect your brain. Make sure you don't have sleep apnea, that you're not snoring, all these different things. Eat a healthy diet, exercise. That would be the best way to prevent the risk of developing Parkinson's disease. And then the other thing I wanted to mention is that, there are genetic risk factors that we are aware of that have been associated with Parkinson's disease. So if you're someone who has a family history of Parkinson's disease and you wonder, can I prevent it since my mother had it and then my grandparents had it? There are studies that are being done to see if the risk can be reduced by genetic modifications, but these are all research. But for now, for everyone, I would say try and maintain a healthy brain.
Y la pregunta fue que si se puede prevenir la enfermedad de Parkinson. Actualmente no existe un medicamento específico que prevenga la enfermedad de Parkinson. Reducir el riesgo de cualquier daño al cerebro es muy importante, como por ejemplo riesgos por presión alta, arterial alta, diabetes. Es importante proteger su cerebro Y también hay ejemplos de factores de riesgo genéticos, como antecedentes familiares, de enfermedad familiar, pero por el momento se están realizando estudios. And I
So
think,
Kenny, I think it's time,
yeah,
unfortunately. I'd love to stay on. I really appreciate these questions. And it's so nice to be able to do this again.
sure. Thank you very much to the whole team over there at the neurology department. What I will do is I will go ahead and send you the questions through an email, and hopefully we could just email blast the answers.